This is Dr. John Babu, Joint Director, Public Health and Family Welfare. I am looking after National Leprosy Eradication Program. The Spurs Leprosy Awareness Campaign is going on now. It was started on 30th of January and ends on 13th of February. 30th of January is considered as Anti-Leprosy Day because Gandhiji's martyrdom day is 30th. So Gandhiji heart is very close to the subject of leprosy. Hence, on that day, Anti-Leprosy Day is observed, and the subsequent 15 days are called Anti-Leprosy Fortnight. During this period, we do the all awareness activities. On 30th January, in every village, a Grama Sabha is conducted to create awareness about leprosy and its signs and symptoms in every village by the health staff, involving all the villagers and Grama Pramukh, that is the Sarpanch of that village. A district magistrate message, if available, will be given by the district magistrate. If not available, the district magistrate's message will be read by the Grama Pramukh or the Sarpanch. And the subsequent 15 days, we have rallies, quiz competitions in schools, essay writings, and lot of awareness campaigns will be conducted to create awareness about leprosy. Leprosy is a chronic infectious disease which mainly affects the skin and nerves in human body. As soon as the leprosy bacilli enters the body, it will settle down in limbs, upper and lower limbs, especially it is affinity towards the nerves myelin sheath. So wherever the leprosy bacilli damages the nerves, that particular nerve, organ of that body which supplies by that nerve is damaged, either muscles or skin. Initial symptoms of this leprosy early symptoms are patches on the skin without sensation, that is anesthetic patch on the skin, and the patch is very dry and the hair is fallen over the patch. And the second thing is thickened nerves, tingling and sensation in the hands and feet. So if identified early and treated by multi-drug therapy, the disease will be cured. If not identified or neglected, it will progress to the further stages. Glove and stocking anesthesia means anesthesia over the hands and feet, and with that, as the patient does not have the sensation over the foot, he will walk on the rocks and all, the foot will be damaged and ulceration will be formed. And with the hands, they will work with the hot utensils and all, the blebs will be formed on the next day and ulcerations will be coming on the hands. So, and whenever you ask the patient or a person to close their eyes, one eye will be closed and one eye will not be closed, and there are blebs over the face. So sometimes face is oily and shiny. All these symptoms, whenever any person identifies such symptoms, you have to contact the nearest primary health center so that they will examine, and if they diagnose the patient as suffering with leprosy, they will treat the patient, register and treat the patients with multi-drug therapy, and the disease will be cured completely. Multi-drug therapy is available free of cost at the doorsteps of the patients, that is near the primary health centers and sub-centers, and it is available free of cost to everyone who are suffering with leprosy. So if any of the persons in the community were identified or suspected with these signs and symptoms, kindly contact the nearest PHC or subcenter for diagnosis and treatment. Leprosy is completely curable with multi-drug therapy. Thank you.